Hello again, everyone. It's about 2 minutes since the last time we discussed, but in real life it's probably been a couple of weeks because I think we're going to separate these videos by a week or two. Anyway, I'm babbling now. We, in the last video, introduced a manual therapy technique that you can use to help work extra range of the stiff joint. We used a traction technique, and we discussed how you can use that how you can do that on your own at home too, right? But one of the super important things when you're doing manual therapy is to really be aware of what too much is, right? And part of that involves really listening to what your body is telling you, which is a great cue to talk about, since we're in a yoga studio here, about sort of body awareness techniques that you can use and to really be aware of what your body is telling you in terms of pain and other types of sensations. So what do you think, what would you sort of recommend that we might practice while we're doing a manual therapy technique to just be aware of what the joint is telling us in terms of pain and other sensations?
I would do what in yoga we call the Ujjayi breath, and the Ujjayi breath is like the Darth Vader sound breath, one where you're doing like I'm trying to be as loud at Darth Vader as I can. And then you slowly exhale. So it's that, mine's really long, so I'll stop, but it's basically where your mind is completely on drawing in the breath. You slightly draw in your torso here, which is called a lock. And what that does is it means you have to really pull the diaphragm down in order to get the breath in. Yeah. And you're slightly restricting the esophagus so that you have to really draw the breath in. So it's like a vacuum in like this. And then when you exhale, it's if you're up against a mirror, it's like you're making fog, and it's like... And then the inhale is like you're sucking it off, vacuuming it off the mirror. So there's that sense of consistently pushing the air out and bringing the air in, which keeps you really mindful of your center, and anything that happens in your nervous system that gets fired, you're in command of it. So you don't actually fluctuate, you just experience presence. So there can be stuff that goes on. If it's bad, you'll stop. Like you'll feel like, oh yeah, that's too much, but it won't be alarm because you're too present. So the nervous system doesn't spike, but the sensation, you know the sensation. No, it's not good. It's too much, but it doesn't create reaction, alarm. It's amazing.
That presence is really that's exactly what I'm talking about. Being aware of what your body is telling you, because when it comes to something like this, you can't go overboard. And a lot of time people think, you know what, more is better. No pain, no gain is a common one that people say. This is not no pain, no gain. It's about just right. We're trying to go just to the edges of tolerance, right? What are just to the edge of that pain envelope, right? So that you're feeling mild discomfort, but not beyond that for this. And really listening to what your body is telling you, and being present and disciplined, and not blowing through what you're comfortable with, or what your body is comfortable with, is really the name of the game. So using a meditative or mindful breathing technique is a great idea. So just a nice little twist that we can sort of throw onto this technique. So thanks for introducing us to that.
You're welcome.
Yeah, fantastic. So once again, James Braithwaite, and this is my humbly introducing my guest, Celeste Shirley, who is the proprietor of the Yoga House here in Toronto, and so grateful to have a chance to talk with you about rehabilitation coming out of your own surgery experience. So great. Thanks for inviting us into your space.
Welcome.
Yeah.